Welcome back to Body Beautiful. With us today we have plastic surgeon Dr. Joseph Mele, and we're talking about liposuction. Let's just go to the phone lines. Edna's been waiting for a bit. Hi Edna, good morning.
Hi, good morning.
Do you have a question for Dr. Mele?
Yes, hi. I'm calling because I had 2 babies and I have a really busy life. I'm very thin, but I still have the tummy, which I'm not comfortable with. My husband doesn't believe I should have a tummy tuck because of the risk.
Sure.
And I was just wondering...
that means he likes you, so that's good.
How risky is it? And if I need to exercise before a tummy tuck?
The tummy tuck...
reduce it a little bit, or...
Well, there's usually 3 things that I'm looking for when I'm doing tummy tucks. I look at, if there's extra fat there, usually it's in the lower part. I look at the skin itself, and if the skin is loose, and also the muscles underneath get stretched out from the babies. So all those 3 areas that we want to address with the tummy tuck. If you cover up everything below your belly button, and you like the way it looks above the belly button, then mini tummy tucks can be helpful. They're a little smaller procedure, a little easier recovery. They don't do as much, but if you don't need that taken care of above the belly button, then it's a good option. If it's round above the belly button or there's loose skin hanging on the belly button, then a full tummy tuck does a much better job and gets rid of that skin. But it's an outpatient procedure. It should be safe. It's important that that you're looked at in terms of your medical health before having the surgery, so those risks can be reviewed before pursuing it.
So Dr. Mele, do you ever recommend maybe doing it as a 2-step process? In other words, try out the liposuction first before you go onto a full-on tummy tuck?
Once in a while, if I have someone who's right on that borderline, because I still can't predict the future, but I'm pretty good at telling who's going to have a good result with liposuction, who's better off having the tummy tuck. But there are going to be some people kind of right in that middle ground who may do okay with liposuction. And if they're reasonable folks and willing to say, well, if it doesn't work, we can do the next step, I'm willing to try that. If they really want a good result, I would just go with the bigger procedure to get the better result.
The common term is mommy makeover.
Yeah.
But what happens during pregnancy and childbirth is that those abdominal muscles is not really so much fat. It's the muscles themselves which are stretched beyond.
The muscles often stretch, and it's not the muscle fibers, but the fascia, which is the tough stuff around, like the case on the muscle. That's what goes into at each end becomes the tendons. When that gets stretched out, it doesn't recoil very well, and the muscles themselves usually overlap a little bit in the middle, and as time goes on with the pregnancy, they get pulled apart. So we may end up with what's called a diastasis, which is a separation between the muscles, and that's something we're repairing at the same time.
Okay, and anyone that's, I guess, had the mommy makeover, if you're a mommy, you know that you're a very busy person. Downtime
All mommies
has to be factored into this.
Yeah.
How about downtime for liposuction? We talked about just
liposuction,
earlier,
that's one of the advantages of liposuction, is the downtime is not as involved as some of the other surgeries that I do. The tummy tuck probably has the longer recovery of most of the stuff I do. With liposuction, usually it's a couple days sore, gets better each day, and after 2-3 days, most people are up doing what they need to do. Though they're still sore, they know something was done, they can do it.
And are there incisions?
For liposuction, yes. Yeah, they're small incisions. They're about quarter inch, half an inch at the most. And the cannulas that I use are 3 to 4 millimeters in size, so very small. And they allow me to sneak around underneath the skin so we can put the incisions in discrete locations. So they're hidden.
Discreet.
The other thing I've started doing is using a little port which goes inside the incision. It's like a straw. So the cannula rubs inside the straw rather than the edge of the skin, and that really makes it heal a lot faster.
Back to the beginning of the show, I mean, are there any safe alternatives to liposuction?
I mean, if you're fortunate and you've got good genes, diet and exercise give you a proportionate body, that's the best answer, and that's always the best answer, even with liposuction. Okay. But if there's disproportionate areas, we really don't have anything that's safer or more effective in terms of the amount of volume we need to remove to help with the shape.
Okay. I'm sorry to all the folks who wanted to talk with Dr. Mele. We can't take the rest of your calls because we have run out of time. I'm sure you can call his office, however. For more information about Dr. Mele, his number is 925-943-6353, or you can check him out on the web at drmele.com or at sanfranciscobreast.com. Thank you so much for joining us. We look forward to your next visit here, the next topic.
Always nice.
Have a great day, everybody. Bye-bye. For more information about our show, go to cron4.com and click Body Beautiful. Once there, you can see videos of past shows and get contact information for the doctors we featured, as well as listings for future shows.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of Cron TV, its management, employees, or advisors.